Hi everyone, today I'd like to present to you one of my study using the Scottish data on the COVID-19 and thromboembolism. I'm Frederick Ho, Research Fellow in the University of Glasgow. This is a paper to be published in the Mayo Clinic Proceedings entitled Thromboembolic Risk in Hospitalized and Non-Hospitalized COVID-19 Patients, a self-controlled case series analysis of a nationwide cohort. So we have a lot of reports showing that a lot of people with COVID-19 have experienced blood clotting events like stroke or pulmonary embolism, blood clots in their lungs. But most of the study were conducted in hospitals. That means they are patients hospitalized for COVID. So they are relatively severe in terms of the symptoms. And we don't really know whether these people with COVID-19 in the community, most of them do not require hospitalization. And we want to know whether these people are still at higher risk of these thromboembolic events. And that's why we conducted a study using the national Scottish data across the whole country. And for the period from the start of pandemic in March 2020 to October 2020, we collected about 1,500 individuals tested positive for COVID-19, and they experienced any types of thromboembolic events. And our study has shown that with a positive test, the risk of any of the thromboembolic event has been increased by 12 times in the first week after a test positive. And the risk are still elevated after 1 week or even 2 weeks for some of the events like pulmonary embolism. And we found that this is a very important finding because these elevated risks are still applicable to people in the community. That means even among those people who were not hospitalized for COVID-19, they were still at a high risk for these complications. And even though their risks are much lower, they only had about 4 times of risk compared to those without or before COVID-19 test positive. Because there are a large number of people in the community tested for positive, we think there is still a large population burden because of COVID-19 causing these complications. And because they are largely unmonitored in the community, so we are a bit worried that they are undiscovered events or things that we didn't know until they have severe symptoms. And that's why we think that this study has very important implication that these complications should be addressed through preventive medications or even early detection in the communities. And clinicians, family doctors, general practitioners should be alerted for the possibility of these events, especially those with residual or prolonged symptoms of COVID. And compared to other study, this study is add important information because we included people that are not in the hospitals, and we conduct several types of sensitivity analysis to ensure the results to be robust. However, we still have a few limitations that we would like to acknowledge. First of all, is that we only included participants with higher risk of these thromboembolic events. So the findings might not be completely applicable to the general population. At the same time, we might have lack of testing in the UK at the first wave of the pandemic. So there might be some misclassification there. And also there may be slight chance of reverse causation because people hospitalized for other causes may catch COVID in hospital or in other ways. So there's a reverse causation chance there, even though we don't think that would sufficiently alter our results. I can't tell you all of the details of this article, but we have conducted a very comprehensive analysis, including probably most of the things that you want to know. So if you want to know more, please read our articles on the Mayo Clinic Proceedings website.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.